Could I look at the people at the back? There's people still coming in. There's still some seats down at the front. I know we're nearly full, but there is space down here. And thank you all. My name's Jamie Bartram. I direct the Water Institute here at the University of North Carolina at Chapel Hill. And I'd like to welcome you to our 6th annual conference on water and health where science meets policy. It's a real privilege to be here and to look around the room and see many who've been here before. So welcome back. It's a pleasure to see you again. It's also really reassuring and encouraging to see new faces. Welcome to you also. I hope for all of us this turns out to be an invigorating, stimulating conference, perhaps provoking some new thoughts. As you may have gathered already this morning, we have an exceptionally large number of participants at the conference this year. People keep telling me that that's a great problem to have, and I'm not sure I believe them anymore. The reason I tell you that is because for the team of people that makes this work, we've just done a crash course in something called adaptive management. So we are trying to make sure that things run smoothly. There will be some adaptations as we go along, and I'm hoping you will be flexible and patient with us as that happens. Some of you will already have seen that we have a marquee behind the dining room, so we have a little bit spare capacity. There are additional rooms that we've established for eating in. On Wednesday, the plenary session that takes place in this room will be simulcast, is the word that I've added to my dictionary this week. I didn't know that one. Into Redbud, in case this room is full. And if we have to make any other changes, we'll be announcing them as we go along. There'll be a notice board at the entrance for that as well. Now is the moment when I like to take the time to thank all of our sponsors. It's thanks to them in large part that we can make this event work. I'd like to pick out our 2 platinum level sponsors, the Bill and Melinda Gates Foundation and Wells Fargo. I wanted to take a moment to look out there and thank Jan Willem Rosenboom and the Bill and Melinda Gates Foundation. Their support specifically enables 6 authors from low and middle income countries to be with us here and to present that work. That's a tremendous contribution. It enriches the event. And I'd like to thank Wells Fargo, who gives us straightforward core support, and that allows us to keep the cost of the conference as low as possible, make sure it's as affordable and as accessible as possible. Gold level, we have FHI 360, the Conrad N. Hilton Foundation, and the P&G Children's Safe Drinking Water Program. Thank you. At silver level, we've received this year support from the International Association of Plumbing and Mechanical Officials, IAPMO, the Middle East and North African Network of Water Centers of Excellence, Plan International USA, PSI, RTI International, and World Vision. Thank you all. At bronze level, Aquagenics, Aquatabs, Aqua Research, a lot of aqua going on, you've noticed that, yeah? Where am I up to? Aqua Research, CPI International, Muddy Drop, NSF International, Sawyer, Tomlinson Industries, the Triangle Global Health Consortium, UNC's Institute for the Environment, WaterAid, and Water for People. And at the Friends of the Conference level, Charity Water and the International Journal of Environmental Research and Public Health. Now, I'm a bit of a believer in audience participation, so could I ask you to join me in thanking them for enabling us to make this happen. In a moment, I'm going to ask Peter Lochen to come up and speak for a couple of minutes, make some brief remarks to us as the incoming president and CEO of the Conrad N. Hilton Foundation. We've had the, I'll say, privilege of partnering with that foundation for the last 3 years on monitoring, evaluation, and learning activities. And I think that commitment that they made to look at what they were doing critically and reflectively and to learn from it from the future is important and is a signal of the kind of reflection and thinking that we as a sector require. As that foundation is looking to maximize its impact in response to the new challenges we have before us because of the Sustainable Development Goals, I'd like to pick out the foundation, the Conrad and Hilton Foundation, for being probably the longest committed entity that has as its guiding principle looking towards the vulnerable and disadvantaged. That's centre stage as we strive to deliver on the equality demands that the SDGs will give to all of us. Peter, would you come up and say a few words for us?
Thanks, Jamie, and good afternoon, everyone. It's day 26 in my new role, so this is an early part of my learning curve, and I'm thrilled to be here with you. Very proud of our collaboration with the University of North Carolina and all that I think it will bring in terms of good for people. I'm also excited to be here as a moment in time. Jamie and I were talking this morning about how this conference grows and grows, and also it's the first, close to the kickoff of the Sustainable Development Goals and the 15 years that we have in those. And Jamie and I were talking about the word Woodstock, and if we might look back on this at the end of 15 years in terms of what we have accomplished. So I'd like to talk a little bit about that. The Conrad Hilton Foundation, as Jamie has said, has a 25-year history in grant making on water and sanitation, particularly starting in Ghana. In 2010, we made a 5-year commitment to a $50 million strategy that would bring access to safe water to 1 million people in 5 countries in sub-Saharan Africa. And many of the partners that we have funded are here in this room, and UNC has played a major role in that as, if you like, the think tank of that operation, our monitoring, evaluation, and learning partner. Now, $50 million sounds like a lot, but it's also a little. When you think of what foundations put into the Millennium Development Goals, we put collectively about $30 billion into the 8 MDGs between 2000 and 2015, basically without a roadmap. We, like many others, thought these are good to invest in, but we didn't start with a very systematic plan in mind. And my own field is not water, but education. I've been involved in Education for All, the education equivalent of what you've been working on for 25 years. And I've seen that when the end of a goal period comes, we recalculate our goals and we push them into the future. And I would like to encourage us to do this differently. I'd like us all to commit seriously to the accomplishment within the 15 years of our slice of the Sustainable Development Goals. So to approach them with an attitude of accomplishment, to look at 2030 and work backwards, to identify opportunities and obstacles, and to think, we have 5,500 days until that period is up. What will we do? We have 700 days, 2 years, to really establish that we have momentum and traction within this, and that it's not just a nice-to-have goal. So in that spirit, the Conrad Hilton Foundation, the Ford Foundation, and the MasterCard Foundation have put together what we hope will be a helpful roadmap for other foundations wanting to get involved in the Sustainable Development Goals, along with UNDP, the Foundation Center, and Rockefeller Philanthropy Advisors, with four objectives: to make sure that data is collected on what foundations fund, where the gaps are, where the opportunities are, to identify for foundations what the opportunities are for the most generative funding, to lower transaction costs so that foundations can find their way easily into the very complex world of global development, and people in the UN or people in this audience here can find their way to the right foundations that could support their work, and to increase the amount of foundation funding coming into the SDGs. That's, if you like, a global good citizen goal for the Hilton Foundation, but I would say that the one of the 17 Sustainable Development Goals that is dearest to the heart of the Conrad Hilton Foundation is SDG 6 in water, and certainly that's where we will put the most of our own resources. And we're working hard to see that that grant making is catalytic, because we know that the dollar amount of what we have is small, so that it can help make important change. That we work in biodiverse partnerships with civil society, yes, but also with institutional funders, with governments, with academics, and that we work in a generative way, coming up with new approaches. We're now at the period of putting together a new 5-year strategy, so ideas are welcome, and I'm sure you have them. So you know who I am. Please come forward with those. And I'd just like to say thank you once again for putting this conference on and for allowing us to be with you. I think it will take us in tremendous ways. Thank you. Bye-bye.
Thank you, Peter. I wasn't quite sure how to lead into the next bit of what I wanted to say, because it sort of begins with, hey, guess what? There's these things called the Sustainable Development Goals. And yet, I think most people in the room know that. So I think I shouldn't lead in with that. But those goals have captured the imagination of the development community. They're entraining energy. In this room, they're a dominant part of many of the discussions that are going on. And accepting that, we've tried to ensure that there is a flow, there's a thread working through the conference that picks those goals up and starts to try and make sense of them, not only as aspirational targets for making the world we live in a better place, not just as things that we can monitor and track and measure, but also actions that each of us can contribute towards achieving that vision of the world in 2030, which is a very much better place than the world we live in today, which in turn is a very much better place than the world we had in the year 2000 or in the year 1990, when the MDGs were launched or when their start point for measurement was established. So I say that because through the conference we've ensured there's a number of side events that concern the SDGs. There are a number of plenary sessions, and in fact we've asked each stream keynote to reflect not only on the subject matter they're dealing with, but how that fits with these SDG goals and the associated targets. We hope that we will be able to produce an outcome of the conference that describes that collective input that we will all be making, the discussions and so on, that starts to document in one place the thinking that's going on around if you like, the science of the MDGs, the science policy, SDGs, and the science policy interface. Now, one of the things that came up in the last couple of weeks as we've finalised the layout from the conference is a suggestion from our colleagues at Plan International USA that it would be really valuable if we had some time dedicated to talk about the institutions that we will need. And that discussion was partly about the institutions we need to deliver on the SDGs, but recognising that building capacities and institutions is a long-term enterprise. It's actually looking towards the year 2030. And what are the institutions that we will need in that year? Not to deliver the SDGs, but to inherit the world that we will have created through successful implementation and where we've arrived at that moment in time. I tell you that because on Thursday evening, at the end of the reception, there will be an additional plenary session that's not in your program books that will look at those questions. We've got a very interesting lineup of people, and we're trying to come up with really nice questions to ask them. So that's Thursday evening, and that's a heads up. There will be more news going out about that in the next day. Now, having said that, the first or a component of that narrative that brings us towards the Sustainable Development Goals is this first plenary talk of the conference. And I'd like to introduce our speaker, Dominick Waal is a senior economist working with the World Bank's Water and Sanitation Programme. He's been working in the Africa region for more than 25 years, working on issues of agriculture, natural resource management and water. He joined WSP around 8 years ago, and since then he's led the AMCAL country status overviews. That's, for those that don't know it, that was a study or a series of studies examining drivers of water and sanitation progress across the last 20 years and 30 countries. He started WSP's Fragile States Technical Assistance Programme, and he's a member of the WSP team that's carrying out a series of WASH poverty diagnostics in 20 countries across different developing regions. That always seems really dry when I read something like that. So I would say that I've personally been inspired on more than one occasion listening to Dominick weave together hard technical information with real policy insight about what's required to advance where we are. Now, I'd like to just say one more thing before I invite Dominick up to the microphone, which is that we've focused a lot in this conference on the SDGs, the Sustainable Development Goals, and it doesn't do any harm to remind ourselves and look back a little. And I looked at the statistics, and we tend to see them in terms of the MDG targets. And we met the water target, and we didn't meet the sanitation target. It's a very narrow discussion. I went back and looked at the numbers. In 20 years, the number of people using an improved water source went from 4 billion people to 6 billion people. That's a 50% increase, isn't it? Have we got any engineers in the room? Can someone do that math? That's a 50% increase in 20 years. The number for sanitation is or the proportion for sanitation is 70%, a 70% increase. In sub-Saharan Africa, both of those numbers more than doubled. That is remarkable. I'd like us just to take a moment to give a round of applause to all the people who are not in this room who contributed to make that possible. We really need to reflect on that progress. We need to understand it properly, and that's one reason why I was particularly pleased, Dominick, when you proposed to talk about how did more than 2 billion people gain access to water and sanitation over the last quarter century. Welcome.
Good afternoon, everyone. I hope you've had a lovely lunch, and thank you very much to Jamie for inviting me today to give this talk at really the bridge between the MDGs and the SDGs. And it's a great privilege to be able to do this. When Jamie asked me, he said, he told me is a better way of putting it. He told me it better be evidence-based. So in everything I've done, I've tried to keep this evidence-based. But of course, to be evidence-based, you have to look back. And so that's what I've tried to do, although with a view to understanding the implementation challenges going forward. And I've done this with a hard finance perspective. Based on a paper written here at UNC, which was titled Universal Access to Drinking Water, the Role of Aid. It looks at the relationship between aid and drinking water access over the period 2000 to 2010. And it uses hard data sources, the OECD CRS database, the JMP database, and some whiz-bang econometric analysis. Now, the conclusion of this paper was longitudinal analysis shows no detectable effect of the volume of aid on progress. Now, that's a red rag to a bull, if anyone. But more importantly, is that we all regardless of what role we play in the water and sanitation sector, we need to have a position, an opinion, on how the $10 billion of aid a year are spent. And in order to have that opinion, we need to think about what has happened in the past. So the first question is, where did people gain access? I'm going to cover three things in this talk. Why is it difficult to make links between sector aid and sector progress? What tools and instruments do we have to influence the progress through aid? And how could we use those tools and instruments better? But the first thing we should do is just ask ourselves, where did the progress happen? Where did these 2 billion people gain access to water and sanitation? Because that helps understand a lot of this. Over on the right-hand side, you'll see in two very large countries, the contribution of that progress, they were responsible for 50% of the contribution of progress. The next 16 countries along here were responsible for the next 25%. So this relatively small group of 18 countries is responsible, or this is where it happened, is perhaps a better way to put it. This is where the progress happened, for 75% of the people who gained access to water and sanitation. But I've added two countries here. First, Somalia. It's the only growing country. There were a few shrinking countries, but it's the only growing country where there are actually 3.3 million less people that have access to water today and sanitation that's combined than was the case in 1990. And Tuvalu, where a mere 3,630 people gained access to water and sanitation. But it's important because small island states are hard to reach, and therefore we have to bear them in mind, particularly now we're thinking about the SDGs. So if you take all of the aid that was spent since 1990, actually it's since 1995, all of the aid that was spent, and divide it by all of those people who gained access, this is the picture you get. That in Iran, with just $1 of aid, they made all of that progress in the previous slide. In China, with just $9 of aid per person who's gained access, they've managed to do that, this amazing leap. But then there's Tuvalu, where an eye-watering $2,804 were spent on gaining access for those 3,600 people, which just shows you the difficulty involved. Right, so that's how much aid those per person who gained access. That's what those countries received. But all of that progress definitely wasn't paid for by aid. We know that, right? Intuitively, we know that. But the financial data is so bad that what we have to do is a piece of mental arithmetical gymnastics. It's going back to Guy Hutton, in fact, who did the MDG costing, and figuring out, based on that MDG costing, using his unit costs, how much it would have cost each of those countries to make that amount of progress, right? So using this data, you multiply through all of the various different profiles of water and sanitation access that there are in these countries, and you can get a rough picture of how much must have been spent by someone somewhere. Could have been a household, could have been a donor, could have been a government. And that gives you this picture. So this is just the share. This is aid versus the estimated cost of these other access gains, right? So this begins to give us a picture, a more genuine picture of who paid for the 2 billion people to gain access. We have here where aid could have, it's not a guarantee that aid paid for it, but it could have contributed this much. And then the blue lines is where governments, households, or other non-official development assistance may have paid for that progress. And of course, there's a couple of other things. Somalia made negative progress, so I'm not quite sure how you picture it on this graph, but I threw that on. And the other 120 countries, there was lots of variation. Some were like China, some were like DRC, or like South Africa, like Uganda. So that's why in that paper that UNC wrote about aid, it was so difficult to unpick what was happening. However much you do econometric analysis, you just can't capture all of the various variables involved that would be confounders in detecting whether aid volumes have an influence. But the paper had this important get-out clause. It said, we are unable to evaluate catalytic aid. So let's look at 3 catalytic influence questions. The first is that domestic capex, that's capital expenditure flows, have grown both in middle-income countries and in low-income countries, but grown massively. China spends, in its latest 5-year plan, $11 billion a year on extending access to water and sanitation. I mean, that's more than the entire aid budget for the whole world in water and sanitation. But these other countries, even countries like Ethiopia, are spending considerable amounts of money, $75 million a year, from other sources, not from aid. So the first question that we've got to get really serious about now is how to influence the growing domestic wash sector capital expenditure. It's no good us just worrying about the little bit of aid that we are managing ourselves. That's no good anymore. We've got to think about how aid influences this capital expenditure made by governments. And just to illustrate this point, to illustrate my next point, I take you to Ethiopia. This is Amhara, but the comment is more generally about Ethiopia. And here this gets a bit technical, if what I've said isn't already. These 3 lines here are non-wash streams of finance, right? So they're not controlled by, likely, any of us sitting in this room. They're controlled by government, they're controlled by people working on food security or productive safety nets programs. These are the traditional forms of aid which are controlled by folks like ourselves, or worked on or worked with by folks like ourselves. Now, what was remarkable about this public expenditure review that we did in Ethiopia in 2009-10 was that the whole discussion around sector-wide approaches was happening around 35% of the sector's money, right? So 65 of that money lifting people into gaining access was flowing through these other block grants, safety nets programs that we weren't looking at, we weren't interfacing with. So the second influence question is, how do we squeeze more and better wash out of the growing streams of non-sector domestic finance? For the third question about catalytic influence, I take you to Port Harcourt, Nigeria, where I've been working with Ranjiv, who I believe is here somewhere. And we've been working in a city of 2 million people, Port Harcourt, where we did a piece of work initially just to look at water quality. We really wanted to understand what was going on with water quality in this city. And because we used a randomized method to identify households, we detected, or it came to light, that the water utility was only serving 1% of households, and that 99% of the solutions were coming from households themselves. There was no regulation of these boreholes and no sewerage, just a small treatment plant. And a lot of this progress was happening through hand drilling or manual drilling. And here's an example of some lads jetting a new well, probably in Lagos. Now, the astonishing facts are this. The evidence is this. Firstly, look here at the 9 million people who had access to a piped water connection in 1990. That has dropped to a mere 3 million people in urban Nigeria. But at the same time, these 12 million people who had access to an improved source has grown to an enormous 68 million people being served by sources other than, if you like, a shorthand, the utility. So, well, $670 million worth of aid was pointed at this. Nigerian households have invested in that. Right? So that gives us the third question of influence, the catalytic influence. How do we capitalize, improve, and regulate household investments in alternative service delivery models? Ones we might not have thought of before, ones we may not have our eye on. And in the case of Nigeria, we certainly haven't had our eye on this ball. So what aid modalities do we have? Which are catalytic, which are not? We have projects. These are very tongue-in-cheek descriptions of what these things are. But projects I would describe as a means of keeping aid isolated from domestic finance to deliver specific outputs. Pooled funding, a mean of reducing reporting burden while isolating aid for specific outputs. Sector or general budget support, mixing aid dollars with domestic dollars to jointly deliver country outputs. And technical assistance, influencing the 3 E's, economy, effectiveness, and efficiency of either aid or domestic finance. So those are the tools in our rather blunt or limited toolbox that we have. So how did we use them over the last 20, 25 years? Well, the project modality has been seriously dominant. In fact, the only 3 countries we can claim to have any creativity in are Indonesia in the response to Banda Aceh, Iran, and DRC. So given our toolbox, we're using 1 tool out of the 3 in the majority of cases, which doesn't seem like a very good way to go. But it's not just me who has reservations about projects. This is the Ethiopian finance minister talking at the SWA meetings last year. And he says it's not an easy task to bring donors to a consolidated pool fund or a joint program arrangement, as some development partners still prefer to operate in projects using their own rules and procedures for budgeting, planning, implementation, and reporting. This situation is highly inefficient and, most importantly, weakens much of the limited capacity available. So he's not too happy about this, and I think he thinks that our aid looks like this. So we've collected 3 ways that aid needs to be more catalytic. It needs to get much better at growing domestic wash sector, at influencing the domestic wash sector capital expenditure. It needs to squeeze more out of better wash, out of growing streams of non-sector finance, non-sector domestic finance. And it needs to capitalize and improve and regulate household investment in alternative service delivery models. But projects do still have a place and can be catalytic. For example, in difficult environments like Somalia, in embedding government institutions and just recreating those government institutions which haven't been there for a long time, to investigate alternative designs and to understand winners and losers in development. So right at the beginning of the development process, in a country where the state is reforming, or where there has been very, very little capacity historically, projects may still have a catalytic effect. But we need to think about how to influence growing domestic wash and capex more seriously. And where there are state providers and citizens, we need to reinforce this so-called accountability framework, which comes from the World Development Report 2004. And one way that I think we should be doing it more is to split the money that flows into the budgets through sector budget support from donors straight into the state, what in the US government I believe is called G2G financing, with the technical assistance that we provide to the other players here. So instead of packaging these two in projects, we should split them. We should send the money one direction and the TA the other direction. And why? Because then there'll be skin, heart, soul in the game. Because that TA has to somehow find out where that sector budget support is and what's going on. And it leads to doing things like this. This is my colleague Belete here, and we're out in a Woreda, in a district in Ethiopia, figuring out how procurement is really done. Here are a bunch of villagers procuring all of the stuff they need to go and do in their wells. But sending the money, which we did a little bit of in Ethiopia, we sent it through the budget, it was actually a pool fund, but still had much of the same effect. And it came down to districts, and it made sure that RTA was looking at how things happened on the ground, how government institutions were working or not working. And these experiences like that have been built into these 4 SWA collaborative behaviors of enhancing government leadership, strengthening the use of country systems, like that procurement I've just shown you, and using information for mutual accountability, one platform, and sustainable water and sanitation financing strategies. So let me go backwards on these very quickly. First, this one, I've already admitted to you we don't know nearly enough about financing of WASH in the world today. It's terrible. We don't know what households spend, we don't know what government spends, we only have some idea of what donors are spending. So we need to get serious about this. We need to work together with governments on that question. The second one is we need one platform for mutual accountability where we don't hear that Uganda is the only country which has a successful joint sector review. I mean, that's crazy. We're doing a review at the moment. I'm doing it with Kirsten Dannett, and we can't find another country to go and do a serious case study of. I welcome anybody who can guide us to one, and I hear that Nepal has made some strides. But why are we talking in this day and age, the age of information technology, why are we talking about one country having a good joint sector review process? The strengthening country systems is perhaps the boring part, but an important part. That's the public financial management, the procurement, the HR. That's what runs government. Those are the generic characteristics that any government needs in order to deliver services. And then there's enhancing government leadership. We all want to do it, but when we developed a sector investment plan for Liberia, it sat on the shelf for 3 years until the Ebola crisis. Then suddenly it got picked up both by government and development partners saying, hey, there's a plan. So we really need to, for this first case of influencing growing domestic WASH for the sector, we need to work on these 4 behaviors. For the second thing, integrating WASH into poverty reduction programs, I want to introduce you to my colleague Sita, who's based in Jakarta. His entire job is to influence things like this: community-driven development programs, of which the World Bank supports 400, worth some $30 billion. Social protection programs. Around 70 countries now have conditional cash transfer programs. And health and nutrition services. So these are all sources of finance that are not managed by anybody who is primarily interested in WASH. How can we squeeze more? And this is what Sita's job is, to go around doing that, to identify these programs, find out where they are, and to help them deliver better WASH. And he often says to me, look, Dominic, these guys have sorted out the last mile. What are we messing around going to the field for a WASH program when a conditional cash transfer, in fact, has not only figured out how to do the last mile, but is much better at targeting poverty than a WASH program would likely to be. Finally, on the third one is tapping the market. And here it's a question of really supporting private sector suppliers, the ones, for example, in Nigeria, plus the microfinance, providing households microfinance to empower them and to help them choose which services they think will work for them. So then bringing all of that together, it's about horses for courses. It's about matching aid modalities to context. And here are 4 proposals. Project finance and technical assistance is appropriate and useful to pull public sector capacity into place and to stabilize specific critical institutions. For example, Liberian Water and Sewer is an organization under chaos and stress right now, but providing targeted support to the Liberia Water and Sewer Corporation is a way to stabilize it. Sector budget support and technical assistance is a way to push service delivery in countries where public expenditure is on par with aid flows, right? It makes no sense doing projects, probably well before countries are on par with aid flows. But when they're on par with aid flows, there's as much money on the developing country side of the table as there is on the aid side of the table. So just split off the aid money and send it through sector budget support. Send it through country systems. And send the TA to go and figure out where it's not getting to where it should be. General budget support and technical assistance is useful where you need to squeeze more out of a WASH. You need to squeeze more WASH out of a safety net. And microfinance and TA to nudge private sector service delivery towards sustainable solutions and give households more control of service delivery models that they want. So next time you go on mission, think, pull, push, squeeze, nudge. What context are you in? In each subsector, where is that subsector? That leaves Tuvalu. Perhaps we can hold the conference there next year, Jamie. Thank you very much.
Thank you, Dominic. And I would thank you for taking to heart so much my polite request about being evidence-based. It's quite remarkable. Could you have a word with some of my students? What you didn't tell people is the other thing I said to you was, don't be shy in giving us your opinions. Thank you for doing that as well. That was tremendous. We've got some time for a discussion, and thank you for being on time with this so that we can do that. Could I ask anyone that's got any comments, questions, thoughts, has just woken up or whatever, to make their way to the microphone, and let's see what we've got that we could push Dominick on. And I can see, can you make, if you're waving at me just because you want me to know who you are, that's great, hello. If you want to speak, can you go to a microphone, please? Can you go to a microphone, please, down one of these two on the side? And the aerobic exercise option's good. That's excellent, thank you. And in the meantime, I know there's a few other people. If we could go to the microphones, that will make the discussion run more smoothly. And perhaps if each of us could say who we are as we speak, that would be good.
Hi, thanks for the opportunity to ask a question or two. I'm a hydrogeologist working around the world, and one observation I've seen in a lot of developing countries is the lack of access to loans and capital for water systems at a household level or a community level. Has the bank looked into or done feasibility on providing resources for those types of programs?
Do you want to take those one at a time, Dominick? Or?
I'll take a few.
Okay, so I've got one for you as well.
Okay.
I'm hoping other people are going to step up. When we went through those analysis, and you picked out some of the phrases from what we'd said, but one of our conclusions was that one of the things we can't measure, we don't have indicators for, is leadership, policy, deliberate decision to deal with something. And it's kind of the big question. We didn't find other explanations, but there's this big potential important factor that we don't talk about very directly very often. The sheer value of senior leadership, whatever the level, getting behind something and saying, this is what we're going to do. So there's one from me, if you could come back on that.
Thank you very much. Fred Muhumuza from Uganda. I think this is around the time I spent 8 years at the Ministry of Finance and battling with the water sector always asking for more money and more money. And our question was about the ease. So what do you think explains those disparities where somebody is using $1 or $2 and delivering more people and $1,000 delivering few people? Where does this money go and where should it go? Thanks.
Hi, I'm Christy Chatterley. Thanks for a really interesting presentation. For your nudge approach with microfinance, could you talk a little bit more about how the aid sector, NGOs, can get involved in supporting microfinance for water and sanitation? Thanks.
Okay, let me respond to those. Firstly, if I understood the question right, capital for loans and capital for drillers provide, but let's think about it more broadly. Service providers, they might be a small service provider in Cambodia or a driller in Ethiopia. There are programs, well, not programs, but there are ways in which the bank has been involved in that. In fact, my colleague Gemma C has run a program called the Domestic Private Sector Development Program, which has been very much about identifying ways to promote that domestic private sector, to find ways to understand better what obstacles they face through regulation or lack of capital or lack of market. What things do they need in order to provide the next step? And she's looked at that. She's done a lot of work on that. And indeed, this area is one that needs to be explored further. And I think is one where actually, I think the bank is a rather clumsy instrument to use. And I think that non-governmental organizations, foundations, are much more nimble and much better equipped to interact with private sector developers, like drillers, like water supply agencies. In the same way, on the microfinance front, organizations like water.org, which seem to be much more nimble, much better at figuring out how to liaise with banks, microfinance banks, and deliver the sorts of products which are used by people. So I think those are all very, very relevant to everyone here. Those are things which can be done and which do make things more sustainable. Which leads me to the question about Uganda and the Ministry of Finance always being asked for more money, which I'm sure happened. I mean, it's bound to happen, right? That if ministry starts financing water supply in a sector, that it's just going to create enormous demand. So I think the question there is really back to you, is did the joint sector reviews provide you any reassurance that the water sector was responding to your claims that costs were going up? I remember being in a number of meetings early in the joint sector review series, probably 2003-04, where Ministry of Finance were raising this question. But I'd really like to know, did the water sector respond, or did they keep on just coming back with excuses? Be really interested to know. Then on measuring the unmeasurables, which is, I think, Jamie's question. What really surprises me, looking back and seeing all of that money going through project financing, is, in a sense, the lack of imagination that it showed in engaging with those unmeasurables. The fact that there weren't clear theories of change that were about influencing the money on the other side of the table. That really surprised me.
Okay, I see at least two people making the three. This is where it all gets exciting. We all get the aerobic exercise and make our way to the microphone. Can we start Mauricio over this side, and then if we go from one side to the other, let's take 3 or 4, and then give Dominic a chance to draw breath.
Yes, this is Mauricio Pardon of the Pan American Health Organization, World Health Organization. Dominic, congratulations for your presentation, and Jamie for the moderation and the remarks. I want to build on a comment that you made, because I think that it is very important. And this was the issue of leadership, and not just of people, what drives, what can drive also in the future investments and improvement of water supply and sanitation services. And the first thing is, I wanted to present an example to you. And this is, for example, the case of Chile. Chile, at the end of the 90s, its leadership, its president, basically, President Frei, suggested, and it's been quoted many times, that Chile could not sustain its model of development. This included exporting food, exporting fruit, exporting model, by appearing dirty. Dirty because in the 90s, the region of the Americas was struck by the cholera epidemics, and there was all of this amount of sewage which was hanging around in Chile, with which they were irrigating much of a lot of the food crops. So Chile began a very important investment process, and in 2015, more than 95% of all the sewage produced by Chile in the cities, sewage, is being treated. So there was a vision of leadership, and the leadership of the government associated to a model of development. I think that this is along the lines of what Jamie was suggesting in terms of leadership. And the other thing is, of course, votes. The votes of the people having aspirations. Latin America, again, to use an example, is a quickly urbanizing region of the world. We're going to add, in 20 years, there are going to be 200 million people added to urban areas. Urban dwellers who, if have not reached middle class status, at least aspire for that middle class status, and is translating their aspirations into their votes. Politicians are offering to put water and sanitation, and many politicians are winning elections in that way, not always delivering subsequently. So leaderships in terms of demographics, So, a word that I did not use when I was talking about Chile, the driver there was trade. Trade, of course, associated with globalization, and demographics in terms of the aspirations of the people. And how this, just to conclude, how these very important drivers, this leadership, who is pulling all of this, will contribute to the next generation of work in water supply and sanitation in the different regions of the world. Thank you.
Hi, my name's Eddie Perez with the Emory Center for Global Safe Wash. Dominick, great presentation. I had two quick questions. One is, so this room has many people involved in research, and historically, research on projects. A lot of their learning and research has been on projects. So what is your vision or suggestions for what the people in this room can do in the future under this new sort of aid architecture? The other thing is, I know you would agree that sort of one of the problems with the macro pictures of stuff is that, you know, sometimes it's the details. And at least in theory, much project funding is targeted towards areas that public finances has not gone to. Rural areas, for example, sanitation versus water supply. So how in this sort of vision that you've proposed here in the future would you deal with what I would call the political economy of public financing of programs?
Thank you. My name is Vaida Duti from Ghana. Of late, there's this growing phenomenon where support to our sector is also being driven through other sectors. So you have WASH in schools, you have WASH in health, and so we beginning to witness situations where sometimes even the funding through the other sectors, which might be related to our sector, might even be bigger than what is going through our ministries. In the presentation that you made, it's more of our sector doing swaps. Going forward, how do we better coordinate with the allied sectors so that we can better count the contribution to the WASH sector?
That's great. Could I ask you to wait?
Yeah.
Don't go away, but
Yeah,
so stay there. Dominick, do you want to come back on those three?
Yeah, I'd like to come back. So this leadership question in Chile, I think, is really interesting. But I don't think that the interesting question is that the government showed leadership and to clean up Chile, as you put it. What's really interesting to us as practitioners is how did that feedback loop work of them putting money into the sector to clean it up and actually cleaning it up? I mean, was it just so straightforward that they were able to, you know, tender a few contracts and the cleanup was done? Or were they facing an India-type situation where the leadership through the Swachh Bharat program definitely wants to clean it up, but it's such a difficult thing to monitor? How do you monitor that? So leadership, I think we should be linking that immediately with this platform of how we monitor what's the feedback loop for the leaders to ensure that things are changing. On the research question that Eddie asked, there are a couple of places where I think research is really badly needed. One is on how governments and development partners can play this game of brinkmanship, if you like, of getting closer and closer to trusting each other, and how that over time they're comfortable putting, development partners are comfortable putting budget support or sector budget support through country systems, and how countries are able to respond to the needs for strengthening their systems. And because it's a two-way thing, it's really, that's why SWA is talking about this in terms of collaborative behaviors. It's not you sort your house out, then we'll come either which way. I mean, whether you're a developing country or a donor. It's about what can we do today together in order to make it more likely that we can finance the system, that your systems are sustainable. And the evidence is this, that countless countries now are just not receiving any support for system building. They're receiving support through projects to build the projects, but not, maybe each project has a little bit of money for system building, but not substantial money for system building. Yet building these institutions is a generational aspiration. It's something that needs to happen over the next 15 years. And so that money to do that, to keep that rolling, not in a stop-start fashion, but in a continuous fashion, that's a real challenge. So how to, what research can be done on that front, on this bringing closer together these two partners. But then I think the second place where research is really needed is on this question that the lady from Ghana mentioned, which is how do we more effectively influence the wash spend or the potential wash spend of all of these other systems, right? We just don't know much about these safety nets programs, these wash in schools programs. What is it that if you're a water sector professional in the Ministry of Water, you should be doing to influence those programs, right? And I think some research, some action research should be done on that front. And then on the political economy of spend, I think I gave the example of Somalia there, of needing to use projects to get things going. But I would say exactly the same for urban sanitation. We're nowhere on urban sanitation, and we need to put in, if you like, risk money, project money, just to figure out what to do. And that will begin to build the institutions required.
I'm going to suggest, this is an exciting discussion. I'm going to suggest we do one more round of questions. And so if anyone's got something they really want to say, can they make their way to a microphone? But let's start over here.
Thanks. Shauna Curry with COST, Center for Affordable Water and Sanitation Technology. Thank you. You've given me a number of things to chew on as I leave here. And I've got two areas that you spoke about that I'd like to provide an observation to get your reaction. So it's not so much a question, but I've got two observations and I'd really love your reaction to. The first one is on your heart and skin in the game with regards to splitting up financing towards the state and to technical assistance. And my observation and what I'd like a reaction to is there's another reason other than the heart and soul in the game is, and skin, is that by separating those two streams of financing, one of the really critical things that needs to be in place with the technical assistance, or the opportunity, I should say, is to create a relationship, because capacity development, so knowledge and skills resides locally at all levels, whether it's at the community level or at the government, is that there needs to be a trusted relationship. And so by separating that, we may be able to move forward on that. And then the second one was the quite surprising, it's not surprising, but outstanding evidence that you provided in terms of 1% of the funding going to utilities, and then 99% by households. So from an investment perspective, that's a huge opportunity focused in that arena. You responded to a previous question that the World Bank is a clumsy institute to be able to focus on that arena. And the trend that I've been seeing is that the foundations and other financing institutions are going more and more and more to the large-scale financing. So where might we put some of the, direct some attention to create those small financing mechanisms? Would love to hear your observations on that.
Jamie, if I may, let me respond immediately
go.
To that. Particularly about this relationship between technical assistance, sending the TA money one way and the TA one way and the money the other way, and this question of trust. Because it's really fundamental. If you want to encourage a principal-agent discussion, a discussion which has unequal power in it, give one person both roles of the TA and to control the money. But if you want to get sector development, send the TA guy with no money, because he or she will have to make good relations with people in order to change the system. And they'll actually understand how to change the system. They'll learn how to change that system between that. By doing that. So I think that at the moment this bundling of money and TA together sometimes has a pernicious effect. And then, then I'll come back to your other question in a minute, but that one I just wanted to respond on immediately.
I thought the urgency of the intervention was to ask people not to tweet your comment about the World Bank, but...
Yeah. My name is Patrick Apoya from Ghana. But I'm representing Water and Sanitation for Africa here. I have only a few questions. Just a few. The first one, if I take your graph and I decided to cut away India and China, how would the picture look like? If you consider them as outliers and look at just the remainder, how would the picture look like? Is it possible we can make a relationship between aid and access? Is it likely to be possible? Number two, about this issue of we just cannot measure. We don't know how to measure. I know the Rural Water and Sanitation Network for over a decade has been saying, hey, self-supply is a major source of financing. Take a look at it. They have been crying. Nobody is even paying attention to them. No government is factoring in self-supply as a way of measuring. All the international measurements are not paying attention to self-supply. But the data that we have seen today is hard. It speaks to it. So is it that we just did not appreciate that self-supply was that significant, or we are only following the areas that we ourselves are throwing our money or are investing our money in? That is something we need to discuss. I think the second thing is, on the donor side, what we measure, I'm sure we're just looking at total investments, but an issue that RRC has also been, has taken on lately is also the issue of sustainable service delivery. If you look at all the investments that have failed, investments that have gone into infrastructure that are not yielding any results at all, if you remove that out of the equation, how is it even going to be like? And is that something which was factored into the financial dynamics or gymnastics that you did? The third thing is about the implications of these findings to ourselves and to the SDGs. Okay? Even in your own organization, the World Bank, is quite conservative in policy, who can get the money, where funds can flow to. Besides Safe Water Network that I see, maybe Gates Foundation, Hilton Foundation, taking risk money that will invest in organizations like that, Safe Water Network, that are in the box, let me say the household box, those who are doing things for themselves. What is the possibility, what are the chances that organizations like World Bank, their mode of funding can be influenced in a way towards your pull, push, squeeze, you know? I think I like that one. But is it likely to influence these kinds of organizations who are big players, and yet their funding is so structured that it's very difficult to shift them in those directions? And also for UNC, I think of course, I'm associated with the Policy Digest initiative, which has come up, and I'm certain that this kind of research is going to take centerpiece in our future work. But just to think that we are dealing with only 35% of the solution and all the energy that we have been fighting with, I think we need to begin to think about how to change the architecture. These are my few concerns.
That's quite an agenda.
Thank you very much. I just couldn't keep quiet any longer, and there were a lot of questions. Everybody's asking questions. How are we going to do it? How can we do it? What are we going to do to make this happen in the next phase of development? And I really appreciated some of the things which you flagged in terms of working with the resources which are already there within country. Because I've worked in Africa. Sorry, I'm Juliet Waterkane from Africa Ahead. I'm from South Africa. I've worked in Africa for 30 years on many, many environmental health promotion programs. And I really wanted to share with you what's happened in Rwanda. I don't know if anyone's here from Rwanda, but there has been a really exciting program there called the Community-Based Environmental Health Promotion Program. This program was actually started through your colleagues, WSP. It happened to be when my husband was with him. So I can, just tell you, it was work which started in 2010. They went with an idea, they went with a model, and they went to the Environmental Health Desk in the Ministry of Health, and they went to the Ministry of Finance. They did not go to the Ministry of Health per se. They said, this is how you can get the best bang for your buck in terms of making the systems which are already in the country more effective. And it was a model. Now, this model, luckily, was taken by the Minister of Health, who had an instant appreciation of the fact that this was a model that put people in the center of development. It wasn't dependent on huge budgets being asked from donors. It was not donor dependent. It was asking the Ministry of Health and the Environmental Health Department to get their act together right from the very top all the way down to the districts to village level. And over the last 5 years, this structure has been built all the way down to the grassroots level so that there are community health clubs in 14,000 villages, all villages in Rwanda, of which 40% have already had training which has enabled them to address and manage their own health and hygiene. And this is a country which is small. I agree, people will say, well, it's easy for Rwanda, but it was leadership, and we were talking about where the leadership. There's some good leadership there, and I really hope that when the randomized control trial results come out next year, I hope that they will translate into people being interested in this model and not be just a bit of research which somebody goes, here's a paper and it's forgotten. Because there are some answers in this model, and I really encourage you to follow this story. Thank you.
Thank you very much. Let me start with the econometrics question, because I don't have an answer and I need an econometrician in the room to say, what happens if you take two really big outliers out and rerun it? I see Rick at the back smiling. So what happens? I don't know the answer, and I'm pretty sure they will have tried things like that, but Jamie, you wrote the paper with Rob, so... let me also redeem myself on social media to say that the World Bank is perhaps not good at supporting the private sector development, but the IFC is very good. And they're a little bit seriously to answer the question on really changing this aid architecture and changing the way things are done in future. As I said at the beginning, I think it's really important that all of us have an opinion on how this $10 billion of WASH aid is spent each year. And if we don't think it's being spent in the right way, it's precisely by doing randomized controlled trials like the one described by Julia that will be the initial fire starter, if you like, to create that feedback and encourage people to change the way that things are done. Thank you.
Brilliant, thank you. I'd like to try and... actually, could I ask everyone that's working away on a keyboard, can you free up your hands for a moment? I'd like you to help me with something. And Dominic, you need... put those things down for a moment. You need both hands free. Come on, put those down. Because I think we need to remember what you've taught us. And I'd like everyone with your arms, pull, push, squeeze, nudge. All right, one more time. Pull, push, squeeze, nudge. Dominic, thank you. That was a great plenary. Thank you. Great words and great discussion. We can now move into the remaining sessions. Thank you all.